Hi everyone, I'm ROBBYN Holland, owner of Stat Healthcare Consultants, and I'm here today to share my top 10 list of what agencies should consider when preparing for an accreditation survey. For those of you who don't know me, my company produces on-demand animated videos for onboarding home healthcare staff, reviewing policies and procedures, and providing the required in-service training. If you're looking to start a skilled home healthcare company, or you want to add skilled care to your current company, or become accredited and build Medicare, then you're in the right place. Surveyors will say they're there to help you, and that might be so, but they're also there to identify what you might be missing. Number 1 on the list, finding a CPA. Starting out with a good CPA will save you a lot of headache down the road. And find one with home health care experience. You'll be required to create a Medicare cost report each year, among other financial reports, and only a certified CPA with industry experience can ensure you're meeting the federal standards. Policies and procedures. I often hear people say someone has given them a set of policies, and that might be acceptable for personal care non-medical companies, but if you're working towards an accreditation, you need a complete, up-to-date, and current set of policies. Surveyors will be looking for very specific sentences, and sometimes even specific words, to ensure you're following their standards to operate your business. Number 3, which accreditation company should you use? Well, I can tell you from my personal experience and from many people that I've talked to and asked the same question, working with ACHC is your best choice. My agency was CHAP accredited, and it was not a good experience. ACHC staff are down to earth, friendly, non-intimidating, and they seem to really want to help you pass your survey. Number 4, carrying 10 patients out of pocket. I learned this lesson the hard way. I was so eager to start running my agency, I brought on my 10 patients immediately. That is an expensive mistake. The accreditation process can take between 9 and 18 months. You don't even need those patients until you hear from your accrediting agency that they're ready to schedule your survey. And that could be near the 9-month mark. And one more piece of advice. Try to admit patients close to your office. And if you have contacts with assisted living communities, even better. Get your surveyor in and out and exposed to as few people as possible. Number 5, hiring a director of nursing. Even if you're a registered nurse, if you don't have home health experience, find an RN who does. This is a very specific and highly regulated industry. For a young agency, your DON should not only understand patient care, but also be familiar with how to code your claims, so you receive the highest reimbursement. Number 6, survey expectations. What can you expect the day of your survey? We've compiled a complete list that you can download by going to our Facebook business page and clicking on subscribe. You can also find a lot of information by going directly to the ACHC website. Create an account and download their standards. Number 7, billing. Is it worth the money to outsource billing? Again, this is from my own personal experience, and outsourcing was worth it to me. I wasn't willing to take the chance of getting a claim rejected while I tried to figure out the issue. The final 3 items will focus on areas where we can provide assistance to your agency. Number 8, mock surveys. A mock survey is such a valuable tool. Once you feel you have everything in place, have a qualified industry expert perform a mock survey for you and your team. I will be a trained ACHC surveyor this summer and able to provide mock surveys nationally. So call us now to add your office to our mock survey schedule. The final 2 topics will be combined under personnel. Documenting training as you onboard new staff and provide annual reviews for those already working is an area surveyors will focus on heavily. Federal guidelines require specific policies and procedures be reviewed, and different in-services offered based on the type of position held. A completion certificate should be dated, signed, and placed in the personnel file prior to sending the worker into the field is mandatory. Considering those 10 items will help you prepare for your 3-day accreditation survey. If you already have a successful agency, visit our website to learn how you can train your staff remotely, whether you have a new hire or need to complete annual reviews. We follow all federal guidelines on our secure site and will customize your very own training platform that meets your specific needs. Contact us today, and I'll see you in the next webinar.